I'm delighted to be joined with Andrew Callaghan, who works as an occupational therapist at Sligo University Hospital, across the road from the school. Now, before we talk about your day-to-day job, Andrew, could you tell me a little bit about your memories of going to school at Sligo Grammar School?
I originally from Castlereagh in Roscommon. Making the jump to go to boarding school was fairly daunting at the time. I was in a 2-teacher primary school, but there was only 4 in my class and about 30 odd in the whole school, to moving away from home to a big boarding house and whole new faces that I didn't know before. So very daunting at the start. Challenging, you like kind of normal, you'd be very kind of homesick at the start and things like that, but once you kind of get settled in, and that, like, the years just flew, and we just had a great time between meeting new people, and rugby obviously was a big factor for me. And many of the schools around Roscommon didn't have rugby teams at the time, so when you're going to school and you're thinking of school rugby, Sligo Grammar is one of the first names that kind of comes to mind. So I suppose that was a big factor, what kind of drove me towards the school as well.
And any highlights from your rugby career at the school?
We were sort of unfortunate. Our team wasn't too hectic as the years went on, but we got to a couple of finals and things like that, and a good few days out in Galway. But no, I never came back with the senior cup or junior cup now, unfortunately. But
and some tight friendship bonds you've made, I'm sure, as a result.
Oh yeah, absolutely. We'd be training like 4 days a week after school. So like, you're with your friends in school, you're training after school, and then you have your matches, and then some weekends, like, we play up some of the northern teams as well. So you're gone for the day with them. So really, close friends through rugby, and still friends with them now. Like, we all well, not at the present time, we don't meet up, considering what's going on. But we're always keeping in contact, WhatsApp groups, and we always meet up. So it's always a bit of crack anyways.
That's always great to hear, and it's reassuring for us as staff and as a school community. So, building upon that, you had the big step, you're in Leaving Cert, and obviously we said it wasn't as daunting perhaps for you to go to college and make that step away. Can you tell us about where you went and what you did, the course-wise, to become an occupational therapist?
So I suppose just originally, with coming up towards Leaving Cert, I had always kind of planned to do teaching. That was kind of my goal, to do primary school teaching, but without really giving it too much thought. It was kind of just like, I was there in 5th year, I was like, teaching is what's for me. But when it actually came down to the crunch time of deciding what to do, I was like, I need to just, take a step back and have a look and see what other professions are out there that I might like or might appeal to me. So, I, been linking in with, family and friends, and of course yourself with career guidance, kind of opened up the door of occupational therapy. And, I linked in with one of the OTs here back in Castlereagh, and did some voluntary work as well, and looked up a bit about the course myself. So I kind of just said, look, that's something that, that's kind of edging it over the teaching. So I kind of just went for it, really. So I went through the UCAS route. So I studied over in Glasgow. So the university over there was great. Like, it was bang in the city centre, plenty of Irish, it was, and as I was saying, I was used to being away from being in boarding school. So moving abroad wasn't that much of a big issue to me at the time. So like, a flight to Glasgow was only 40 minutes from, like, you'd be nearly quicker getting to your door in Glasgow than you would if you were going down to Cork or whatever, to college. So it really wasn't a big problem for me moving abroad,
So can you tell me a little bit about the content of the course and what you did, and how much work experience you did?
Yeah, so the work experience was we had 1,000 hours to do over the 4 years. That's the kind of guidelines, and that's the same for physios and speech and language therapy, all the other health professions. And the course itself was very good. It was very practical, which kind of suited me pretty well. And we did a lot of work with physios and nurses and social workers, a lot of group work as well. You might give a hospital scenario about a case of someone, and you come together as a group and you'd work through it. So there was a lot of that, which definitely stands to me now in the hospital, because you're always linking in with other multidisciplinary teams and that kind of thing. So as opposed to your kind of, 40 hours a week, just library books. It was very much kind of, as I say, practical and a lot of placements. And I think that really kind of stands to you, especially with the course and the job and what it entails and that.
So the duration of your course, I'm assuming, was 4 years. So can you
Yeah.
tell us then what you did since then and where you've worked?
So after the 4 years, the plan was to kind of work over the NHS. It was kind of like the thing to do, just do your year or a couple of months, But I came home that summer and I was just working just part-time, non-OT related, just a summer job. And I actually just started then doing a bit of voluntary work at Mayo University Hospital. And from that then a temporary post came up for 6 months. So I was sort of foolish not to jump at that. So I took that on, and then so I did my 6 months there, and then I was fortunate enough that a job came up in Sligo University Hospital. So then I moved across to there, and I'm in Sligo just over 2 years now. Yeah. So.
And the word that really comes out to me there is, a couple of times you've mentioned voluntary, and I'm sure that's related obviously to work experience as well. How important do you think that is for our students to bear in mind, especially with the health science related career?
Yeah. I couldn't recommend doing voluntary work. It's high enough. It's really like you might have an interest in something, or someone might be telling you, oh, this is a good profession or this isn't a good profession, but until you yourself go out, see it firsthand, see what goes on a day-to-day basis, you don't really kind of know, you don't get to really experience what goes on in the workplace, so I remember people saying to me, OT, consider OT and that, but it wasn't literally until I actually went out and saw it happening that that really kind of prompted me to actually pursue it. So that's something I'd highly recommend to anyone who's considering a course, is to try and get a bit of voluntary work, or even just experience, or that, and fortunately for me it led to a job, so there's another side of it as well.
Another plus. And sometimes it can be difficult, as we know, to get work experience in that particular area due to confidentiality issues, insurance issues, etc. So I suppose really it's important just to emphasize that you could talk to professionals even if you can't actually get the practical experience.
Oh, absolutely. Yeah. Now, in when I was in Castlebar, you needed to be vetted and things like that to get your voluntary. But I was lucky enough to get voluntary work there. I think over in the hospital now they don't tend to do it as much, but definitely they have open days and things like that. So for just to even talk to one of the OTs about the course and that. So again, I'd highly recommend for anyone considering to get involved with those days and that, and to link in with myself or anyone else,
That's great, Andrew. Thanks. The one thing I'd just like to wrap it up here is just to ask you about a day in the life for you as an OT in the hospital. What is it that you do?
So the OTs, well, broadly speaking, so the OTs in the hospital, we kind of cover, basically there's an OT kind of in every area. So you have your stroke, neurology, medical, orthopedics, surgical. So generally speaking, when someone comes in, what you do is you go through how they're managing on a day-to-day basis at home. And kind of based on that, you kind of work with them in the hospital through different assessments to try and, with what we say, get back to their functional baseline. So by carrying out cognitive assessments, washing and dressing assessments, see if they can manage the shower and dress themselves, see if they're managing, able to get in and out of the bed, a chair, toilet. You even do kitchen assessments, see how they're managing making a meal, meal prep and things like that. So based on all your assessments, then you kind of, if someone was fit for home, you discharge them from OT. If they were medically fit but needed still a bit more help, you'd recommend rehabilitation for a while in one of the local hospitals, St. John's or something like that. Or you can also look at other services such as home help or Meals on Wheels, or just something, or day centre, to kind of help them get back into their normal routine once they're discharged from hospital. So that's broadly speaking. But of course, when you're on different wards, depending on the needs of the patient, that's obviously altered a little bit. But that's generally kind of the aim of OT in the acute setting in the hospital. So. And
it's true to say, of course, it's a very, it's a transferable skill, and you can move anywhere in the world with this type of a job. So that's a huge plus.
Yeah, as I say, what got me into it was doing the voluntary work with a paediatric OT in Castlerea, and since then I didn't even have a paediatric placement or worked in it, and I can't say for definite, but I can't see myself working in that area anytime soon. So that's the kind of beauty of OT. You kind of, you can work in pediatrics, community OT, you can work with learning disabilities in the hospital, mental health, there's a range of areas you can go into. You're not just kind of tied down to the one place, so that's, I kind of like that aspect of it as well, that you can move across and work in different areas and services.
Oh, it's great to hear there about the variety and the prospects with this particular career. I suppose it's fair to say we can't not talk about the current pandemic, and I'm sure it's very difficult for you working in the hospital on the front line on behalf of the wider community. You have to thank people like yourselves, and I'm sure it's a very different place to be at the moment.
Yeah, it is, like, but to be fair to Sligo University Hospital, they're well as prepared as can be. Each day is just completely different, like, but like us working on the wards have been alternated. The main entrance to the hospital has been moved, like, but to be fair, everyone is sort of chipping in, like, from like, security and us, and like everyone is doing their bit just so the hospital can run as smoothly as possible. But yeah, it's business as normal for us. You're going in every day, and you're doing your 9 to 5, and like nothing has really changed. So like, just as I was saying, day by day, kind of see what happens, just hopefully keep the numbers down, and hopefully everyone will get through it all right.
Well, thanks very much, Andrew, for taking this time during this particular time for us. We're thinking of you all. And again, thanks for imparting all of your experience in your journey to date as an occupational therapist.
Yeah,
Thanks
no bother
a million.
at all. No, thanks for having me on. Yeah, no bother.